In this video today, we're going to talk about psychedelics. What are they, and are they really helpful for mood and pain? If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand how to be able to beat physical or mental pain and get back to leading the life you deserve. Today, we're talking about psychedelics. For those of you who haven't heard about this hot topic, it has a whole host of misinformation that's been present in the media, and it has had decades of up and down stigmatization, right? So when we take a look at this topic, one of the things that kind of prompted it was actually looking at a title that was present in CNN Health. And this title is How Psilocybin and the Psychedelics in Mushrooms May Rewire the Brain to Ease Depression, Anxiety, and More. So the question is what is more? And we're going to talk about that today. When you look at the aspect of the article, it goes on to say, well, there's different things that historically has been fitting into this category. And historically, they've been like things like magic mushrooms. And what's the lingo for psychedelic mushrooms? And how does this actually fit? Is this a bunch of hooey? Is it a bunch of malarkey? Well, actually, what they've seen is in some clinical trials is that doses of psilocybin, which we're going to talk about in depth and detail on how it works, has been useful for those patients who've been suffering with treatment-resistant depressive disorder, as well as pain. And it's been better than traditional interventions like antidepressants and such. For those of you who are joining us live, love it. Glad that you are here with us. Really appreciate the support. Those of you who are joining us later, leave so in the comments and let us know what you could potentially be able to do about how we can be able to make this more apt and optimal for you. One of the major books that really kind of revolutionized this was a book that's called How to Change Your Mind by Michael Pollan. As a matter of fact, I have to give credit to a friend of mine who told me about this book a while ago, and in doing the research on it, it is really a book that talks about what's the science of psychedelics, how does it change consciousness, dying, addiction, depression, and transcendence. An interesting book and an interesting read. When I talk to other physicians about this, they're really kind of like, yeah, but is there substance behind it? And as you guys know who follow our channel, we very seldom comment about things that we can't be able to support. And so when we take a look at this, we can see there are major research institutions which have looked at this with a degree of rigor and understanding to basically suggest this is not something that's a flash in the pan, but really has value. Places like Mass General, obviously. Places like Stanford have looked at this. Washington University, which has even not only looked at psychedelics as a whole, but how they relate in terms of how they affect the brain and the network in which they communicate. And probably the preemptive place, which has really done some of the most research for years, is that of Johns Hopkins. And what Johns Hopkins has done has been instrumental in keeping a lot of this research alive. When we take a look, how long has this really been out there? This is what we see, is that there was a fair amount of research in the 1950s, 1960s, and it was really starting to take off. And then you see this dip that takes place in the 70s, almost all the way to the mid 90s. And the question is why is that? And there's a number of different reasons for that, but there's one paper in particular that elucidates this clearly. It's a paper that talks about the therapeutic potential of psychedelic drugs, past, present, and future. Take a look at it. It's in neuropsychopharmacology. You can find it for yourself. It's under PubMed, easily able to be accessed, and it's free. In 2017, and what they basically do is they recount the history. And the history dates all the way back to prior to 1950s, where they looked at things like LSD and other things along that. But as you look at the very line at the very bottom, you can see in 1970, President Nixon signed the Controlled Substance Act, where it made LSD and psilocybin a Schedule I, which in essence changed that utilization and stopped research for many institutions that said, you know what, this is not something that we want to pursue. Hopkins was a little bit different from this and followed a different path. And what they did is they continued that research and really started looking into things. And nowadays, this topic in particular has really had this upshoot in being pursued and looked at in depth and detail. So some of the topics of how psychedelics might be useful are the following different categories. It's been potentially useful for depression, been useful for addiction, been useful for ADHD, and interestingly enough, useful for pain. For those of you who, again, are new to following our channel, we frequently look at how mood intersects pain and how the two are related. And it's not just where you see one as a happenstance, but frequently they augment each other in this cyclical kind of way. And we know that not just because it's an element of it just happens, but we can look at the brain and spinal cord nervous system and see those things that are interplay, where we can see the limbic system, the cortex and cortical systems, and how those pathways have a close similarity, both emotively and nociceptively. So in regular English, basically how those things work through circuitry that's built into our bodies. So it is definitely a syndrome that is connected and is not in someone's mind. So when we understand this, we can be able to better understand treatments of how to be able to utilize this. And so one of the ways that this research has really started to advance is it started to advance in the following ways, where they've looked at these different domains of research of psychedelic therapy. And it's not just about people just doing something and just hoping it works, but to say, how does this affect the self-processing system? Are there areas of how it improves connectedness, which we've talked about in other talks, that connectivity has a huge element of how the brain interrelates and how that impacts things. When we look at the valence systems, both negative and positive, which basically is how does the body respond to fear and threat? How does it respond to reward? How do you increase the approach of motivation? How can you decrease that aspect of rumination? How do you improve different things like the regulatory systems, like circadian rhythms and sleep and wakefulness cycles, arousal and such things of that fact, cognitive systems, and how to be able to look at the aspect of components of flexibility and cognitive control, and also habits and agency and ownership. All those things are research that are being conducted and looked at. So people would say, yeah, okay, I hear you talking. So what does that really mean when we get down to kind of the nature of it? Is there things that is really legit? Is this something that you can really be able to identify? Well, we can be able to make it somewhat understandable. And what we're going to do is kind of give you the essence of how these things interrelate. So there are papers that look at the understandings of neuroplasticity, and how we define neuroplasticity is how the elements of the nervous system is able to change and modulate according to different stressors or reward elements that are able to change how it can be able to function. And so this quick little graph from that paper shows there's multiple different ways in which it actually changes things in the specific aspect of the molecular chemistry and biology that's present. Whether there's changes in increase in BDNF, how it potentially changes other portions of molecular systems that can see increases in synaptogenesis, the aspect of dendrite increases. So what happens with the neural synapses, how they can increase and function, how you can be able to have sprouting that takes place. And those things of the nervous system can improve overall function, improve overall mood, and potentially be able to improve pain. There's a paper that takes some of the most common psychedelics and kind of breaks it down with an understanding of like how this is in place. And so this particular website / article looks at an introduction of 5 psychedelics: psilocybin, DMT, LSD, MDMA, and ketamine. So we're going to kind of go through that real quickly. So what they actually talk about is, so psilocybin is a natural psychedelic developed from 200 species of mushrooms. It's useful for depression, anxiety, addiction, and PTSD. Its mechanism of action is the serotonin agonist. And if those of you who have followed our channel or follow medicine in specifically, you know that there are specific SSRIs and treatments that follow with the aspect of antidepressants that are useful not only for mood, but also for pain. But how they actually interact and what the downstream kind of flow is can differ. And it's one of the reasons why this may be more useful than some traditional medicines. So going back to that particular element, what we see is the following, is that there's a number of research that's being conducted. We can see that it can be helpful for depression, anxiety, addiction, Alzheimer's disease, which we're going to talk about very briefly, and anorexia and others. There's another utilization of a different, which is like LSD, which historically has had a stigmatization that's associated with it. But as we look at that research post 1970 into the mid 90s and going forward, what we see is that it was first synthesized in 1938 by Albert Hofmann. It can intensify emotion and perception, and it has similar indications as mentioned before. How it actually works in the context of therapeutic or useful medical components is that it binds to serotonin and dopamine receptors, and it can cause activation of those. There's research being conducted, and there's ways to be able to evaluate, can this be useful? MDMA, which has its own nomenclature as those who probably know it and recognize it as ecstasy, has seen that it has indications for PTSD, autism, narcolepsy, and ADHD. And it was initially formulated in 1912, and originally to induce euphoria and increase sociability. But what we can see is the mechanism of action functions on increasing reuptake and release of serotonin and norepinephrine. It also increases oxytocin release. And these things, when used appropriately in the right context, can be able to provide value. Now, I'm not saying to go out and find this and use this inappropriately. Frequently, when it's combined in combination with appropriate therapy at the same time, it may be able to provide value. And that's one of the things that particularly a lot of these research centers are looking at. What's the utility and how can we deploy this to help those patients that have had challenges and issues with traditional treatment? And one of the latter two aspects of psychedelics that are out there from that paper is DMT, which is a natural and synthetic psychedelic that they have been in place, was originally synthesized in 1931. It was developed from plants. The mechanism of action, as you can see again, is serotonin receptors. It's been useful for depression and addiction, and there's a number of different clinical research that's being conducted. And finally, one that we've talked about multiple times on our channel, and I use personally in my own clinic, but is not traditional as a psychedelic, is the use of ketamine. And it was originally developed in 1962. It has indications for depression, bipolar disease, anxiety, suicidal ideation, addiction, chronic pain, arthritis, and fibromyalgia. We can see that typically it works on the aspect of NMDA receptors, but as we've spoken about and talked about previously in the past, there's a whole host of different premises on mechanisms of action of how it works. So to kind of reiterate, and using a paper to be able to kind of clarify this, in essence, what we're saying is that we can be able to explain this and give you semblance of how to be able to understand it. This paper talks about that in kind of a simplistic way, and that is the following. It looks at how things work when you have a traditional aspect of serotonin that's present that is affecting the components of a limbic and stress circuitry, meaning the serotonin-rich area, versus these other areas of the cortex, and how on the bottom row, you can see the elements of psychedelics, and on the top row, traditional SSRIs, right? And one of the things that we see is looking at that middle box is, so traditional SSRIs can reduce things like stress, impulsivity, aggression, anxiety. And if we look at the bottom row, it can be able to decrease rigid thinking. Again, coming over to that third box on the top, you can see functions that are enhanced or increased resistance, increased emotional blunting. At the bottom row, you can see increased environmental sensitivity, increased emotional release, and can be able to decrease depression and increase well-being. And that's really what we're trying to get after. How can we be able to be functional so we have stability, but we also can be able to identify how and why we hurt? So what's the common thought process from traditional healthcare providers? Do they really accept this or not? Well, this actually was identified and looked at in this one bar graph that was put forth that looked at considering the use of psychedelic assisted therapy to treat mental health conditions. Because the fact of the matter is many patients feel very concerned with having this discussion with their providers, whether they're nurse practitioners or whether they're physicians. And green you can see is strongly disagree, and red is strongly agree, right? And so the first statement is, I support the ease of restrictions on research barriers to drive medical research and therapeutic best practices in a psychedelic assistant. What we would think is most people would say they strongly disagree, but that's not the case. You can see they either agree or strongly agree to consider looking at research more to be able to evaluate it. I support the coverage of psychedelics for medicinal use. And you can see that, again, it's an agree and a strongly agree. If faced with a medical condition for which psychedelic medications were shown to be safe and effective, would you consider it? I can see, again, strongly agree and agree. Should psychedelic assisted therapy be approved? And would you like to refer or provide if your patients to assist their psychological therapy? And again, the vast majority are agree or strongly agree. And so I state that because I think there's a lot of hesitancy by patients to engage in this conversation. Is every medical provider going to say yes? Of course not. But are there some progressive providers that might have a conversation at least about it and look to learn more about it, whether they refer you to someone who can be able to see, is this an option versus a traditional treatment which hasn't responded? Yes. So going forward, let's talk about those neurodegenerative type treatments, and are there things which maybe this can find a role? And what we see is there's a paper that talks about, are psychedelic medicines the reset for chronic pain? And you can find this in neuropharmacology. And what we see is the evolution of that is it looks at things like the following, is it looks at, can this be able to impact things like physical pain and emotional and social, spiritual suffering? And what this looks at is the elements of somatic, or what the body feels, nerve type pain or neuropathic mechanisms, psychosocial influences, spirituality, fear of death, and that there's a value of this evolving nature of understanding pain. And I think it's one of the things that we do that's unique as part of our channel and as part of our practice that looks at this in a broader way. And why is that important? Because you can see within that same paper, they talk about pain and how it actually relates on a musculoskeletal and inflammatory standpoint, but also on a neuropathic and the overlapping pain. And one of the things that we see is that those low-dose psychedelics that deal with that serotonin receptor downregulation that's present in the DRG, which we've talked about, the dorsal root ganglion, and the anti-inflammatory effects that are present. Yes, that's what I said. Anti-inflammatory effects may be useful in this context, particularly for peripheral pain mechanisms and those that are maintained by central mechanisms. If you look on the right-hand side, we can see that those higher doses can be able to improve neuroplasticity and potentially circuit changes, which can help with central sensitization. And when you use those big words, in essence, what we're talking about is how pain not only starts, but how it continues in a cycle, and how this can potentially be able to break that cycle so that people can be able to get back to leading their life the way that they deserve. All right. So let's talk about, is there value in being able to look at this with neurodegenerative changes? And yes, there certainly is. And so one of the papers that talks about is it looks at neurodegeneration and can it be able to improve neuroplasticity and increase in neuronal cells? And the synopsis and conclusion of it is that they had been looking at an animal model, and what they found is that they're able to upregulate neurotrophic factors, things that are focused in and around the nerve that can encourage neuronal survival, promote neuronal growth, and have profound effects on the immune system that otherwise wouldn't be present. So at the end of the day, psychedelics themselves aren't just classed and thrown into the sort of like party element of just having a good time. There's research being actively engaged in some of the best research centers of saying, what's the value of this? How can we be able to utilize this in a safe and effective manner? And how can we be able to help people understand how to be able to punch pain in the face, get back to leading the life that they deserve? Thank you so much for joining. If you have questions or comments about this, please leave them in the commentary below. And if you are interested in more videos like this, consider subscribing to our channel so we can help those people that you care about or even yourself. Have a great day.